is Libby Jones, and I am the director of the Overdose Prevention Initiative at the Global Health Advocacy Incubator. And I just want to welcome everyone to this morning's briefing on the top issues in overdose prevention. This morning's briefing is hosted by the Overdose Prevention Initiative, along with the O'Neill Institute for National and Global Health Law, in collaboration with the Congressional Addiction Treatment and Recovery Caucus. I want to personally thank everyone for attending today's event. Apologies for those of you who don't have seats, but we really appreciate you coming out this morning. I also want to thank the reporters and journalists who are in attendance today, and I just want to note up front that this event is open to the press during opening remarks and the panel discussion, but all audience Q&A will be closed to press. So we have a tremendous panel of experts assembled today. Can't wait to jump into the discussion. But I have the privilege of introducing Congressman Paul Tonko of New York. Congressman Tonko is co-chair of the Addiction Treatment and Recovery Caucus, which is the first and longest running congressional caucus that is dedicated to combating the addiction of disease, or the disease of addiction. Now in his ninth term, is that right? Ninth term representing New York's 20th Congressional District. Congressman Tonko is a tireless advocate for overdose prevention. And so with that, I hand it over to Congressman Tonko.
All right.
Well, thank you, Libby, for your kind introduction, and welcome everyone. This is a great crowd, and we're so pleased by the turnout. Let me on the outset say, for those who are here representing colleagues of mine and of Representative Dean, if as staffers you want to get more involved, please call either Representative Dean's office or mine, Emily, who's right here. We'll be happy to work with you because this is a bipartisan caucus. We're hoping both Republican and Democratic colleagues come by today, but this knows no bounds. This crisis knows no boundaries of any kind, so certainly none that should be political. So thank you. And it's also great to always have the assistance of Libby. Thank you, Libby, for helping us organize all the time. You just provide great skills, and thank you for the work you do at GHAI. And to our moderator, Harry Kinane, Regional Resource Director for Cannon Treatment Centers, and the son of Representative Congresswoman Madeleine Dean. So she's proud of Coy. Thank you, Harry, for being here today. And our panelists. So we have Dr. Lloyd, we have Regina LaBelle. They'll all introduce themselves in their work. Jim Carroll, unfortunately, our Rear Admiral Chris Jones is under the weather, cannot join us, and Dr. Andre Johnson is with us also. We thank our panelists. It's my honor to welcome everyone on behalf of the Addiction Treatment and Recovery Caucus. I'm proud to be a longtime champion for access to addiction treatment and reducing stigma around the disease of addiction. The ATR Caucus has a 20-plus year history of strong bipartisan support for recognizing addiction as a disease. I'm excited for the official relaunch of the caucus and the kickoff with today's briefing. I serve in the ATR Caucus leadership as co-chair, along with Congressmember David Joyce, and our vice chairs are Madeleine Dean, seated in the front row, and Jen Kiggins. Thank you to the Overdose Prevention Initiative at GHAI and the O'Neill Institute for National and Global Health Law for your partnership in hosting this meaningful briefing and for your continued advice and insights on how to reduce overdoses. This is a loss many of us know all too well, the loss of a daughter, a son, a father, mother, sister, brother, and neighbor dying are much too young and are a much too powerful story for us not to respond to, and they are leaving behind grieving families. Communities are being ripped apart by poison seemingly beyond our control. And I look forward to today's briefing, which will explore top issues in overdose prevention. I'm encouraged by the recent decline in overdose deaths, and I believe that we must support the proper resources and policies to continue that decline. We have much more work to do. So welcome to all of our panelists and to our moderator, Harry. I look forward to hearing from you where we are now and how we can continue to move forward in the right direction. And I'm happy to see that so many people are here today with an interest and open mind to learn and spread the word. To everyone, thank you for joining, and let's continue to learn together and enact meaningful policy changes seeing this disease for what it is, acknowledging it as an illness so that we can make our great strides forward. But also in these troubling times, where we're hearing about immense concern about cuts to programs, let's move forward to make certain that we're informing everyone as to the work that's being done, the importance, the efficiency of it, the efficacy, and certainly knowing how critically important it is. We should not deny hope to anyone that is living with, struggling with the illness of addiction. Now it's my pleasure to introduce a person who I consider a great friend, a neighbor from the Commonwealth of Pennsylvania, neighbor to New York, and who has just great passion about fighting this illness. She gives it her all. She's a great leader in the House of Representatives. I'm just proud to serve with her. Please join me in welcoming our Addiction Treatment Recovery Caucus Vice Chair, Congresswoman Madeline.
This is a great crowd. Good morning, everybody.
Good morning.
I am so delighted for this interest in this room. I was fearful that we'd get maybe that you'd be busy with so many other things, but thank you for being here. Thank you for caring desperately about what we can do as citizens of this country to turn down and turn away the loss of life, the loss of family members, the loss of productivity, the loss of a future for so many of our citizens who are struggling with the disease of addiction. I'm delighted to be co-chair with Paul Tonko. I think you can see just from his words and his way what an extraordinary public servant he is, how he cares desperately about his constituents, and that filters out to my constituents and to constituents all across this country on so many important issues. So thank you for leading the way, Paul. Thank you for inviting me to be co-chair of the Addiction Treatment and Recovery Caucus. It is aptly named because we have to talk about the disease of addiction. We have to talk about the power of treatment, and we have to talk about the hope in recovery. And so Harry and I get to tell that story from our personal point of view. My task here is to be very brief, and I will do that because you have a panel of experts, all of whom I know, all of whom I respect, and I learn from each and every day, so thank you for that. I will say one quick thing, if I may. I am so encouraged by the numbers coming down in terms of overdose, but I'm also worried. I have talked about more than 100,000 people a year dying of overdose. I call that a jetliner a day of souls every single day in this country falling to the ground, as you said, wrecking communities, tearing us apart. And so we, I believe, as members of Congress, along with experts and families and advocates, have to figure out what we do to ground that flame. And what I think the numbers show, and the experts will tell us much more, is that the reduction in numbers, and the numbers, if I'm looking at them right, 87,000 deaths in a single year versus 114,000 in the previous year. That's a savings of 70 lives, 70 souls a day. That is powerfully important to those families, to our communities. But we still have 84,000 folks dying of overdose, dying of a disease that we can do something about. And so I want to point out and literally ask the question, how do we get, what is the key to that reduction in deaths? I think it is prevention, education, treatment, hope, and recovery. It is carrying naloxone. Don't be afraid to carry it. Normalize it. We save lives that way. I carry it in my pocketbook. But I also think about the disparity. Who is left among those who are still dying? And there is great disparity in those numbers. And so my bigger pleasure is to introduce to you our moderator today, Harry, a new title for you. Harry Canan. I have 3 sons. Harry is my middle son, in whom we are well pleased. Harry is. Sounded almost biblical, Harry. He and I have had the honor of telling our story of struggle, of our family story of struggle, as Harry was in active addiction, the struggle to figure out what was going on, what was going wrong, but the extraordinary hope in the fact that when we did confront him and we said, Harry, we know what this is. You need to get professional help. Are you willing to get help for the disease of addiction? And he said one word, yes. So more than 12 years later, here we are, and he's now working in the
Thank you. I'm supposed to briefly introduce myself now, but I don't have much to say after that. That was, well done. Thanks, Mom. So my name is Harry Canan, and I'm a person in long-term recovery. But like all of us in recovery, we're so much more than that. I'm a husband. I'm a father to 4. I'm a son. I'm a brother. I have the opportunity to work for Care and Treatment Centers as the Vice President of Business Development, and I'm the managing partner of a small firm called Ghost Pepper. But I'm here really to say and to learn, as Rev Tonko said. My hope is that we can learn together today, so that we can enact meaningful change for so many of those that are out there that continue to struggle. Before I begin, I just want to briefly, express my condolences and our condolences for the tragic loss of Representative Turner, and say that, we're here today to hold a briefing for new members of Congress to discuss the current state of addiction, including overdose deaths in the United States. As my mom mentioned, from 2023 to 2024, we saw more than a 20% reduction in overdose deaths. And this is really promising news, and yet we know that the disparities continue, and the issue that we face as a nation remains great. Consider a few points that, from the year 2000, we've lost more than 1 million people to overdose. And to substance use disorder. I think that is something that is hard to wrap our minds around, but again, is why we're here to continue the fight. And a recent RAND study found that over 40% of people in this country personally know someone who has died of an overdose, and that makes up 125 million Americans. Again, as overdose deaths are now down across the board, we still see disproportionate rates of overdose in Black and Indigenous communities. And today's panelists include people who work every day in their communities to prevent, to treat, and to help people recover from substance use disorder. They include people who have lived experience with recovery, and we plan to kick off the discussion with some questions for 2 former leaders of the White House Office of National Drug Control Policy. The first is Jim Carroll. Jim served as director of the White House Office of National Drug Control Policy, a Senate-confirmed position in the Trump administration. During Jim's tenure, ONDCP sought to ease unnecessary barriers to prescribing medications for opioid use disorder and to increase prevention efforts. And next is Regina LaBelle. Regina is a professor at Georgetown University, where she directs the Master of Science in Addiction Policy and Practice. In 2021, she served as acting director of the White House Office of National Drug Control Policy, and also served at ONDCP during the 8 years of the Obama administration. We're beginning our discussion today with Jim and Regina because it's important to show that the issue of substance use disorder and the overdose epidemic truly is bipartisan. And there is more that binds us together than that divides us. So I'll throw this first question to both of you. But what priority areas should the new administration focus on in the coming years?
Thanks, Harry, and thank you for being here today, and to all of you for attending this morning. And I'm so pleased to see so many friends, so many of my students, current and former, as well as colleagues who I know are really devoted to this issue. And when we think about the priority areas, they haven't changed over time. And I actually was pleased to see, and it was, there's a lot of news right now, but if you noted last week, there was extradition of some Mexican cartel leaders that was very, very big news. These were cartel leaders who had been sought out for many years. So in terms of priorities, we do need to, certainly look at rule of law internationally. I think that's very important. But also the priority areas need to remain that we reduce barriers to getting addiction treatment, that we reduce the harms associated with using drugs, and that we promote prevention and recovery. All those are priorities that we've had for a long time that should continue in this next administration.
As Professor LaBelle noted, there's a lot of students of ours, both current and former, in here. And if I asked you to rise and wave your hand, I would be included, not as a formal student, but as she is someone who has taught me a great deal. And I also think it's important to recognize so many friends here who also are experts. And so to the media, to the folks that are coming who are new to this issue, I'm looking at Chad Jackson, Rob Morrison, Jacqueline Hackett, if ONDCP is here as well. And I do want to say, give a special thanks to Jacqueline, who helped me at the beginning, and I'll explain why, of my service at ONDCP, including Jacqueline holding my hand literally and figuratively a few times when we hit bumps. My daughter is in recovery from a dependence on opioids. I started my career as a criminal prosecutor back in the 90s. And back in the 90s, as a prosecutor, fresh out of law school, I knew that the best way to treat people with addiction was locking them up and putting them in jail. You learn in about 6 months, you see the same people cycling through. And we didn't have drug courts, alternative courts back then. But you knew something wasn't working. In the fall of 2017, when I was serving in the White House as the Deputy Chief of Staff under General John Kelly, great man, my wife called me and said, come home. And the White House is kind of chaotic. Oh, by the way, I do need to say, all my remarks are off the record. I am currently at the White House in a different role. I'm not here as a representative of the White House according to the ethics lawyers. I'm here on behalf as an FOR, friend of Regina. I appreciate her including me. But I came home and we turned out our daughter had become dependent on opioids, starting with a prescription. And those, it sort of changes your mind when you see your daughter in recovery. And you see her in detox, throwing up, hallucinating, and Congressman, you understand that. So I'm probably, I work at the Trump White House for 3 years. I worked in the President Bush White House for basically all 8 years. I'm now back in the White House. I am the most fiscally conservative person in this room, I promise you. I also promise you we are not nearly spending enough money on this issue. And some of the money that we're spending is misdirected. I think the most important thing to sort of also say is we have a living example with Harry that recovery is real. And in my daughter, and despite me looking incredibly young, I have 2 grandchildren from her, and she is alive and well, and hopefully I'll see her the week after next. She's down in Georgia. But I do want to make sure that everyone understands that recovery is real, that it happens, and that it's an amazing gift, and it's a rebirth of celebration, your new birthdays and new anniversaries. And so thank you very much. Regina was the one to call me and allow me to be part of this panel. Thank you all for coming. I do want to correct, and all the reporters should take very careful notes. I want to correct Congressman Tonko right now. You ready? He said bipartisan. I'm going to amend the record to reflect that it's nonpartisan. It's not even left or right. It's the whole spectrum. And so, do you think, Congresswoman, that you will forgive me for?
I'm going to tell him.
Yeah.
They'll be happy.
Thank you all very much.
Thank you. So coming back, and we'll start with Regina, but I'd love to hear from both of you on this. What are the areas of common ground and, on drug and substance use disorder policy that can be found in this Congress?
So I think that we need to focus on the basics, right? We need to focus on preventing substance use among young people and identifying mental health conditions that might lead to youth substance use and other risky behaviors. So focusing on mental health. Making sure that we don't go backward in terms of the advances that we've made in expanding access to medications across the board. There were some new rules that came out that were, and also laws that were passed that changed, that really made a significant change in accessing medications. And then also, so prevention, treatment, support for recovery, and then also, I think we can also find common ground in naloxone. Now, naloxone is something that reverses overdose deaths. It is commonly accepted now. Let's make sure we expand that even more and also reduce other harms associated with substance use through syringe services programs, for example. So those are things that we've worked on together in a nonpartisan, bipartisan way in the past, and I think we can continue that in the future.
Absolutely. You know, I think if you look at this as sort of a three-legged stool of prevention and education, treatment, and then interdiction and stopping the flow of this poison coming into our country. Almost all of the drugs that are killing us in the U.S. are coming from outside the U.S. And so it truly is stopping the flow. But all three of these things matter. You can't just do two. You certainly can't just do one. And so, you know, again, there's really no daylight between, I think, any of us on this panel. Naloxone should be ubiquitous. You should have it in every hallway, every dormitory, every car, every backpack, like so many of us, including me, carry it because God knows when you might need it and you want it handy. It's the fire extinguisher, right? And I think that at the beginning there was some stigma even around naloxone. Oh, that will encourage use. This is a disease. If that was so easy, it doesn't. Having a fire extinguisher does not make you a pyromaniac. And so, you know, that's how we need to think of this issue as treating someone with a disease. You know, there's also the unintended poisonings that are taking place, and I think that's part of the issue is we need to make sure that we're prepared just if.
Thank you. I think the fire extinguisher analogy is so powerful, so I love that. And one more question before I begin to introduce some of the other incredible panelists here. But because this is a briefing for new members of Congress, what advice would you give to new members as they enter this new session?
So I think the most important thing that everybody needs to remember is why we're here, right? And remember when you first came to DC, I remember distinctly when I first came to DC, and you know, you don't forget what it felt like to walk into the Capitol for the first time. You know, that has to remain with you all the time. And the second thing to remember is the faces of the people who have died. If 40% of people in this country know someone who died, we can name their names. Right? I know that there are many people in this room who have lost loved ones. That has to be at the forefront of everything that's done in this issue. Will it save lives? And that has to be the front and center thing that everyone thinks about. And for new members, don't get cynical. You know, for people who just started here, don't get cynical, because cynicism is the biggest problem that we can face going forward.
You know, I don't want to kid you. One of the things keeps me going is my faith and my belief that there's a better life out there for the people that are suffering. I have it in my family. Harry has it. And so I think for the new members and the new staff that are new to this issue, it's, you know, don't give up and recognize stigma exists and do everything in your power to eliminate stigma. And the stigma comes in many ways, both direct and indirect ways. And so it's making sure, you know, that the people that are in West Virginia, how many states are you in? West Virginia, Kentucky? Tennessee. That regardless of the community, regardless of the color of the community, the wealth of the community, that these communities out there, rural, urban, suburban, need this issue. And it's affecting every single person. And 40% know someone who's died, about 100% know someone who's had a family member that suffered from addiction. And So that would be the biggest thing, just educate yourself. I will say, since I can't give out my White House email, if anyone wants to call me, I'm happy to direct them to experts up here, but my personal cell phone is 703-919-9522, and I'm happy to answer phone calls, or make Jacqueline answer phone calls. Jacqueline, do you want to, I'll just forward them all to your voicemail. But seriously, call me, I'm happy to come back up privately. I know Regina is, we'll come to any member's office and show a united front on this issue.
Thank you both. And thanks for sharing your phone number.
Is it real? We're gonna check.
Yeah.
No one's texted me yet.
We should acknowledge.
Yes. Yeah, so I do want to just take a moment and acknowledge, thank you, Representative Lee, for being here. I don't know if there's anything that you'd like to say, but thank you for joining.
Detroit Recovery Project has saved so many lives in my district. And
That's right.
Thank you so much. And now I have the opportunity to introduce the rest of our panel. As we mentioned, unfortunately, Rear Admiral Christopher Jones is under the weather and unable to join us, but we have two pretty incredible folks who are doing really meaningful work on this issue. So first, I wanted to introduce Dr. Stephen Lloyd. Dr. Lloyd wears many hats and is an internal medicine addiction doctor who currently serves as West Virginia's Director of Office of Drug Control Policy. He is also known as the doctor who was portrayed by Michael Keaton in the Netflix movie Dope Sick. And then we also are joined by Dr. Andre Johnson. Dr. Johnson, a native of Detroit, and is the founder, president, and CEO of the Detroit Recovery Project Incorporated. Dr. Johnson is a national leader in the recovery field and received the Champion of Change Award from the Obama White House in 2016. Thank you both for being here. I'll start with Dr. Lloyd. You're now a state official as well as an addiction medicine specialist. What is the current state of the overdose epidemic in West Virginia? West Virginia has nearly a 30% decrease in overdose deaths. And with this, how do you foresee us maintaining that progress? Oh, yeah.
I can yell, I'm good.
Turn it on.
Thank you. So when I took the job in West Virginia, I assumed that I was going to a barren wasteland. It's always, if it's a bad list, it's at the top. If it's a good list, it's at the bottom, which is kind of how West Virginia's been for a little while. When you look at the opioid crisis, the hardest hit, targeted by the pharmaceutical industry. Just a really tough place. And so that's what I thought I was going to find. And when I got there, what I found was the most components of a recovery-oriented system of care that I found. Guys, we're not going to make progress in this until we address this in our jails and prisons. I'm sorry, we're not. The numbers are too big. You can address it outside in the community all you want, and I'm for that. I'm for saving lives and for helping people find recovery. But until we address it in the criminal justice system, it's not going to matter. It's not going to move the needle. And in West Virginia, we have treatment behind bars. And it's amazing to me. We have 10,000 incarcerated individuals. 4,780 of them are on MAT behind bars. Now the problem becomes when they come back into the community. It's that, Andre wrote the book, right? It's tying the system together so that we have a system for them to come back out into, to where we can not only give them medication that can save their life, but help them build their own life. Sometimes we never talk about that. So I think what we're seeing in West Virginia right now is the product of a lot of years of work by a lot of really good people. And I didn't do any of it. I'm smart enough to recognize what has been done and what I think we can do going forward. So I think it's more than a blip. I think it's a trend. I can tell you that August 24 over August 23, overdose deaths are down 51% in our state. And I think it's interesting. But it's interesting. I think what the Congresswoman said is pertinent here. Number of lives. That's about 378 lives that are here today that would have been gone otherwise. And if you look at, if you don't care about anything else, look at the economic impact of that. It's a dad, a mom, a brother or sister, somebody who's around to raise their family and contribute to society rather than, you know, what I see so often after my talks is a lot of people standing there holding a picture. And so I think it is a trend. I think we're headed in a positive direction. But I want to also tell you, and first of all, Regina, thank you for everything. I met Regina and Jacqueline Hackett in 2015, and you know, you guys changed, and I'll never forget it. But if you look back, I think we have to guard ourselves against what's out there. And Jim just said it. The stigma that's associated with it. I had a terrible day yesterday. And that doesn't count landing at Dulles last night. I was supposed to be landing at Reagan, and I realized I was in Reston, Virginia. But if you look at what happened yesterday in West Virginia, we levied a tax on overdose reversal drugs. We levied a tax on fentanyl test strips. And the reason that tax was levied was because, quote, these people created this market, and so they should have to pay for it. I can't get, as a physician, I can't get that in my head. As a human being, I can't get that in my head. And I would argue that, I'm so glad the senator decided to explain himself and his rationale, because I have an explanation as well. And that is, if I use your rationale, then we need to tax type 2 diabetes medications. Because type 2 diabetes is behavioral. It's not eating right and not exercising, so it's behavioral. And so these people created a market for type 2 diabetes medications, so therefore we ought to tax it. And of course I don't believe that. And I don't think anybody in this room believes that. But guys, it's still out there. And my fear is in some places where we've made progress, and I want to thank Jim Carroll for all he did when he was director of ONDCP and expanding access. But if we're not careful, it'll leak back in. And I got the feeling yesterday that it's okay to let people die. It's not okay to let people die. And if I get to that point, I hope somebody loves me enough to tell me it's time for me to do something different.
Thank you. Dr. Johnson, it's become commonly accepted that recovery supports are part of the continuum of care for people with substance use disorder. Can you explain what recovery supports are and the role they play?
Absolutely. Excuse me. First and foremost, I do want to just take a minute and thank you, Representative Rashida Tlaib, for. Is that all right?
Oh, yeah.
Thank you for the compliment, and thank you for representing Detroit, Michigan, and all that you do in our community and on a national level. It was an honor to be in your office this morning and meet with you. You know, recovery is something we say that's non-linear. Nobody has the same process for recovery. And I think it looks different based on communities that individuals live in. Obviously, I'm from the great city of Detroit, which has historically been a predominantly black community. And we know that 80% of the black community have had significant impacts from substance use disorder. So when we talk about recovery, first thing is remaining drug and alcohol free. And I always say you can't take a clean fish and put it in dirty water and expect the fish to stay clean. People go to treatment for 30 days, 60 days, 90 days, and then they return back into their communities with little to no resources or limited resources. And so when we talk about recovery support, we're talking about how to support people in there to be able to sustain long-term recovery. Number one, that requires adequate housing that is supportive, that helps to sustain and promote recovery. Number two, employment. I mean, it's one thing to get clean and then not be able to find a decent job to just take care of yourself. And some people need skills, some people need education, they need support to access employment. So employment, employability skills, housing, and just general recovery support tend to be the three biggest needs for people who are striving and seeking recovery. Myself, I'm a person in long-term recovery. That means I haven't used drugs and alcohol in over 36 and a half years. I got clean at 18 years old. And I'll tell you, I recognize the value and the importance of those three areas, because guess what? Those were the three areas I needed most when I got completed treatment within 120 days in 1988. And it wasn't if I didn't have that house to live in for 2 years, I lived in the house for 2 years with 10 men. And I don't want to tell y'all the stories about the 10 men. But I will tell you one. One loved to lay in the bed naked. That was horrifying. But it was also motivation. So, you know, it's so much to unpack when we talk about recovery support services. We talk about continuum of care. We're talking about physical health. You'd be amazed at the number of people who haven't had dental care in 6 months or a year. I talked to women who never had a mammogram, who were 50-some years old, men who were 60 years old, never had a prostate examination. So we're talking about holistic care. We're talking about building a true recovery ecosystem that supports physical health, mental health, spiritual health. There's a whole aspect associated with it.
Thank you so much. It's one. I'm just thinking about the motivation. So I want to go a little bit deeper on the recovery workforce. Could you tell us a little bit about who makes up the recovery workforce, and what are some of the current challenges the nation faces as we try to grow the recovery workforce?
Well, I'll tell you, I mean, myself, my colleague, Dr. Lloyd, and a number of us who are in long-term recovery, we make up the workforce to a certain extent. But again, depending on where you're at, I'm from Detroit. I have a staff of about 80 employees. 80% of our staff are people who are in long-term recovery, and they make up the workforce, which means we pay taxes. And we show up for our families. We're responsible parents. We support our communities. And so for me, it's about really being mindful that, you know, we all are byproducts of a bigger system, which is the recovery community at large. And so we're the best investors that you invest in, because we help change and impact other people's lives. Our nonprofit is 80% funded from the federal government. And so the morality that our staff are faced with right now, the skepticism that our staff are faced with right now about the possibility of no longer being employed. I don't know how you all may take that, but I certainly don't like that feeling whatsoever, to be worried on any given day. I mean, we have a nation that has been struggling with drugs and alcohol for decades, and we've gotten a little bit better. And we've only gotten better because of the experts and because of the workforce. And so it's important to continue to support the experts and the recovery workforce in this country.
Thank you. Dr. Lloyd, as an addiction medicine doctor, you use medications to treat people with opioid use disorder. Tell us more about the role medications play in treating opioid use disorder and how you work with patients to decide which medications you use.
They keep people alive. I've had the hardest time explaining this concept, and you really wouldn't think you'd struggle with explaining this. It's hard to treat dead people. And I just haven't been able to figure out how to do that. If I can keep them alive long enough, it can help to get to some of those underlying drivers of addiction. And I teach addiction all across the country, and I teach it in East Tennessee style, slot machine. All right? 3 sevens come down on the pay line, that's when the money comes out the bottom. These are genetics, trauma, and opportunity. And we can't do much about genetics, but trauma and underlying mental health issues, we certainly can. And I got help with that as a young doctor. You know, I got addicted to OxyContin and Xanax, in my chief resident year, and I got the best help out there. I'm a physician. It costs too much money to replace me, so it's better to rehabilitate me and put me back in my job. And so I go off to detox, and y'all kind of find this humorous. I didn't know what detox was. I had no clue. I know now. And when I was in there, I assumed that we were all going to the same place. There were 24 people on my floor at Vanderbilt University in Nashville. And after a couple of days, I realized that there was one person going to leave there and go get help. The rest of those kids were going to go back to the street in 5 days. And one of the things that gets me, and I want to make sure, this is the one thing I want to talk about today. I'm so tired of hearing this. I'm so tired of hearing they didn't want it bad enough. They hadn't found their mom. I'm so sick and tired of hearing that. Because nobody out of those 24 kids, and they were kids, guys, I was 37, they were 18, 19, 20 years old. And at night, they would sit around, if one of them was leaving the next day, they would try to come up with a symptom to buy one more day. So you think about that. So if you're going to come up to me and tell me somebody doesn't want it bad enough, you're going to really struggle, because these kids wanted it, they just didn't have the opportunity. And so, and I will get to the answer to your question, I promise, but this is so important. Medication is just a tool. It's a tool to quell cravings. Cravings are why people relapse, right? And the cravings that people have for drugs are 10 times stronger than mine. Their cravings are for food when we're hungry, water when we're thirsty. So I have people all the time, they find out I treat pregnant ladies, they say, oh, doctor, look, these women just need to stop. Need to quit, hurt the babies, hurt themselves. I was like, you don't actually thought of that early on. I need to give them some tools to be able to do that, because a lot of them are coming out of trauma histories that my Sunday school class don't want to know about. And so medication is a tool. It keeps people alive. It gives us a chance to get at those underlying drivers. And I love Andre, by the way. And what Andre said is so right. I stepped into a system of care, I don't know if there's any other doctors or MDs or DOs, but this. If you have a doctor come in that has a substance use disorder on day one, what percentage of them are, and I hate these words, are clean and free of all drugs and back at their job in 5 years? Can you make it a guess? 78 to 95%. Why is that? They smarter than everybody else? Nope, I'm a member of that category, and I can tell you that is for sure not true. It's because the system of care that they step into. The system of care, you have no idea what it's like to sit where I'm sitting right now. 21 years ago, I was laying in a bed thinking my career and my life was over. And I had people step into my life and put me into a system that put me in DC today. Most kids out there step into a system that puts them in jail, denies them medical care, taxes medication that saves their lives. We got to stop doing that. Okay? You have to be careful. I told Andre just walking in, you have to be careful about disparaging a drug addict. Right? Because the same drug addict may find recovery. And the same drug addict may drag their kid out of hell. And so I think we have to change our mindset on medication, because I get this from the recovery community, right? The recovery community, 12-step community. Oh, if you're on medication, you're not in recovery. Well, first of all, what's your definition of recovery? And second of all, why not? To take it just a step further, it's more than just handing somebody medication. Andre is so right. It's about helping people. First of all, housing. For God's sake, you gotta have housing. None of us would look and smell like we do right now if we slept on the street last night. So we have to look at quality recovery housing. We have to look at job training programs that puts people back in the workforce and allows them. Let's just listen to Harry after starting off. I don't know Harry from Adam until just now. And Harry talks about, I'm a father of 4. Wow. What's the ROI on that? I heard RFK Jr. say something I agree with. He said, when somebody finds recovery, they pay for themselves. And I think he's right about that. And so medication is just a tool. It's a very valuable tool. It needs to be widely available. When Jim Carroll was the director of ONDCP, we had these artificial limits on us that Jim helped to get rid of through the years that allowed us to treat more people. But it's more than just handing somebody medication. It's helping them build a life in recovery. And so the thing that drives me every day is building. Andre actually wrote a book on it. I stole everything, I know. I want a system of care that no matter where you touch the system, you get the help that's right for you. Because what happens now is you get the help that's right for whatever your insurance company determines is right for you, or you get the help that whatever that treatment facility provides is. And so if you're a hammer, everything's a nail. And so it's a long-winded answer, Harry, but I think it's pretty close to being the right one. Medication is a tool. It saves lives. It is not the end-all, be-all. There are more things that are required. And as human beings, I would think that would be something that would be appealing to everyone. And get off of this with one last thing. One of the biggest barriers I see a lot of times is in the faith-based community. And I'm sorry, I'm a Christian. I go to church every Sunday. Okay, it's required. I see pushback from the faith-based community. And sometimes I have to get smart in my reply. And I never saw Jesus a single time in the New Testament say, we can help you, but we need to go over here behind this barn because we don't want you with the rest of the people. And so I know addiction medicine gets where it needs to be when our offices are on the same hallways at Hopkins and Yale and Harvard and Mayo as the pulmonologist and the cardiologist, and that our patients come into the same places and not run down trap houses. because that's unbelievably stigmatizing. My rule of thumb is if I wouldn't bring my kid here, then there's something wrong.
I'm sorry, it's hard for me not to agree and talk about a couple of things. One you just mentioned was on the economy, on making sure that there's recovery support places like housing. But I do want to talk about jobs. One of the things that I really want to see, and there's a couple, like two that I know of that have started this. We hear so much back home and in Detroit about the economic recovery zones, and if you start a business in this, few square blocks, there will be tax benefits. Let's do that dedicated to employers that hire people in recovery. That's the workforce recovery. Cluster, put them together and start, that type of. And I saw one of the first trips that I did with Jacqueline Hackett was a sandwich place in Baltimore that hired, was very recovery friendly. The owner, there's multiple chains. The owner was in recovery. And he said, I always start people in recovery at the same place, so they're all in recovery at one place instead of dispersing them. And what he taught me, this is where I think the workplace recovery can be so smart, is one of the people relapse before they relapse. And that is they make sometimes, the decision, oh my gosh, there's so many support systems around me that are crumbling, I'm going to use again. And but by having these people together in their first recovery workplace, they can recognize it in each other and see, uh-oh, he's about to relapse. And so it's only upon stability, getting them out into other locations. And so workforce recovery, stable housing, again, is so much on the criminal justice side. We were talking about a report put out by ONDCP, Jacqueline, I guess it was 2 years ago. Criminal justice costs for people who are suffering from the disease of addiction, $15 billion. So there's so much work that can be done in the criminal justice system. Sorry, I had to get in there.
No, that's okay. I think, it's so important, the workforce, the supports, the medication. We need access to every tool that we have available. A question that I'll open up, again, and we're getting a little bit tighter on time here, but I want to open this up to the whole panel here. Because I think this is a really important one, and it builds off what we've just been talking about. Currently, each state is receiving billions of dollars in opioid litigation settlement funds. How can these funds be best spent to expand access to care, prevention, treatment, recovery, to build the type of infrastructure that is needed, not just to curb overdoses, but really to help improve the nation's health? So we can just, if we want to, Regina?
So, as someone who serves on a board for an opioid litigation settlement fund said at a gathering we were at last year, the opioid settlement funds are not enough to make a big difference, but they're enough to fight over. And what we're seeing is states are decreasing, states are going to see some cuts, particularly if, God forbid, these Medicaid cuts go through. States are really going to be struggling. And they're going to look at these dollars as a pot of gold. Again, there's no way the dollars that are out there can fill up any Medicaid dollars that don't go to states. But what they're supposed to do, and Chad Jackson is on the committee in DC working to do this, it's supposed to help, it's supposed to be additive, right? So it's not supposed to supplant existing funding, so you're just filling budget holes. It's supposed to make things better. It's supposed to go towards employment for people in recovery, for housing for people in recovery, to fund those things we haven't done, to get us out of the issues that we're facing now, and to build the structure so that we have the infrastructure that's necessary to address addiction today and going into the future.
I think I want to say something I'm slightly off question, and before you throw stones and rocks at me, if you want me to finish, we're talking about destigmatizing the disease. There's one issue I think that we're not emphasizing enough, and that is increasing stigma, if you will, on young kids about the dangers of what is out there. I think that any of us in the room, those of us who have children at least, in high school or thereabouts, if they saw their friend drink a six-pack of beer and about to get behind the wheel of a car, they would yank the keys away from them. If they found a pill online, and I think about the Bipartisan Policy Center and the work they did on social media, if they saw, just because there's that same stigma in education, prevention, if they saw them take a pill at a party, that they didn't know where it come from. So we do want to make sure that we are discouraging naive drug users, I'll say, from starting down that path. That's the only stigma, if you will, that's tolerable. The rest of it, and we talk about, again, when I talk to people of faith who sometimes are a bit critical, I go back and remember this prayer book at my church, and on the wall, this little side chapel, it says, do not be afraid, I'm with you. And that says it all, is we're going, don't be afraid, we're with you, we're going to hold you through this process. And that's exactly what my faith teaches me, is we are going to be with you and not abandon you.
I promise you everything I'm telling you guys is true, okay? I'm also the chair of the Opioid Abatement Council for the great state of Tennessee. And I have a huge fear right now that we're going to blow this money. I'm scared. Virginia's right. It's not enough to abate the opioid crisis. How do you bring somebody back from that? There's not enough money for that. We all know it. But this is blood money, by the way. And I think by the way we spend it, we will honor those that have lost their lives. And so there's one thing we haven't touched on that we need to touch on, and that is involvement of people with lived experience. And I'm going to embarrass him, and you all don't know who he is, but he's standing in the back of this room. His name's Troy Sandiford. And Troy's a kid that I met back in Tennessee who's been in jail more times than he probably want to admit. And so is his significant other. And they started this thing called Hustle Recovery. How do you survive this life every day? And they basically show up and they pick people up and they try to get them into treatment. They know what the barriers are. Troy's significant other, Kim, detoxed from opioids and other drugs on the jail floor. And the medical care she got was from her cellmate. They know that, guys, people with lived experience know where the holes in the system are. I go in and look at it. I didn't live that. I was a doctor. It was privileged. They were not. And I think that we have to look at people with lived experience to help us identify these gaps and holes. And one of the things that Troy came up with that I love so much is that we got this person here and they need to get into treatment. You call all the treatment facilities. Well, we can get them in 2 weeks. I'm sorry, they'll be dead in 2 weeks. And so he came up with this idea that let's house them and let's try to get them unsick. And he knows this doctor who will help him. And we get them unsick, and then we get them into treatment. Guys, this problem's not going to be solved in D.C. I'm sorry, I love this place. It ain't. And it's not going to be solved in Nashville, Charleston, West Virginia, Raleigh, North Carolina. It'll be solved in communities. It'll be solved and greatly affected by people with lived experience that can show us where these gaps are and help us find paths for people to recover.
Yeah, and I would just add that we got to do our due diligence with these dollars. And for me, it means to really just fill the holes. It means really explore the gaps. It means really sitting down with individuals in your community that have that experience, that lived experience. And that's the only way you're going to understand what's really going on in your community. I think it's easy to make decisions from high ground. But until you sit down on the same level, eye-to-eye contact with individuals who've been affected, then that's when you really can feel what's going on. At least that's how I kind of operate. And I've had a degree in psychology, but at the end of the day, nothing like sitting down with somebody, a mother, a son, a child who's grieving the loss of a relationship of their parents because of alcoholism or because of addiction. And see, I've been impacted because my mother, who was a registered nurse from Michigan Department of Correction, died of an opioid overdose on 9/11 after working for 25 years. And so and my 11-year-old brother found it. And I had to be the caretaker and the guardian for my youngest brother. So for me, I think things always hit differently when you've been impacted directly. And that's why I think all of these beautiful panelists are here today. And thank you, Congresswoman. I mean, having people like you all, O'Neill Institute, come together and bring these conversations, because these conversations need to happen every day at your church, in the community hall, and then that's when we can really begin to meet the rubber where the road is for recovery. Thank you.
Jim, thank you for your cell phone. I want all the cell phones, Harry. Collect them. I'm leaving. I'm really just so heartened to be here with all of you. I think Harry's doing a pretty good job as moderator. I like embarrassing him. Votes have been called, so I'm not leaving because I'm not interested, but I do need the cell phone. Thank you.
All right, so we have just a few more minutes before we open it up to questions. So I'm going to try to move a little bit quicker here, but you know it's hard to skip any of these questions because I think they're so important. But quickly, Dr. Johnson, what should our treatment system look like to fully support people on their journey?
To sustain recovery. I mean, ultimately, our treatment system, we want to build that recovery ecosystem that, again, really takes a comprehensive look at health and wellness for individuals seeking recovery. I think the more we build our treatment systems around long-term success, long-term sustained recovery, it just doesn't happen in 28 days. It's about building a recovery community beyond the residential treatment state.
Thank you. I'm going to go a little bit out of order here, so I don't want to throw off the panel too much. But Dr. Lloyd, I want to ask you a question that I think is so important. You know, from all of our experience, I think we often say that this is a family disease. The state of West Virginia has been hit hard by this epidemic for decades. And one research study points to over 300,000 children in the United States have lost a parent to an overdose. Given these statistics, can you tell us more about what your state is doing to aid children who are being raised by grandparents or caregivers? And what can Congress do to help families in this situation?
Yeah, thank you. It's a really pertinent question. And, you know, we look at neonatal abstinence syndrome, our babies being born independent and going through withdrawals, and that's a terrible thing. Nobody wants to watch that. But that's a finite amount of time. The real key is 0 to 18. All right? When that child goes home, what kind of environment they're going into. I've argued forever that the first step in prevention is treatment of mom and dad, and I believe that. And so I think that we have to keep going upstream, further upstream. You know, there's things that we can do in the hospital now to my friend Stephen Patrick has done great work in this, in not using medication, not exposing developing brains to opioids in the treatment of neonatal opioid withdrawal syndrome. And so those things are all well and good, but I'm really interested in 0 to 18, and really in particular 0 to 5. And one of the things that I love about being in West Virginia is we do have resources. We have put some things in place that are awesome, and I didn't put a single one of them in there, and it hurts my feelings, okay? I'm not going to take credit for it, but our former drug czar, Rob Gupta, did. And one of our programs is Moms and Babies, and we provide wraparound services for those moms and their families, because we have a lot of single mommies from 0 to 5. And I think we have to be looking in those terms of providing that support when mom goes home from the hospital. Hospital stay is short, 18 years is long, right? And what happens in those 18 years is going to be really, really crucial to what happens to that child. I'm in jails a lot, guys, and I get to leave, but I shouldn't be staying in there. But when I'm talking to the folks who are incarcerated, and now they're been in there a little while, so their brains are starting to clear up. They're crying. The moms are crying because I have addiction. Does that mean my kid's going to turn out to be an addict? And I get to give a great answer to that. The answer to that is no. Right? It's going to be what happens from here on out. So I think anything that we can do to support those moms early on will prevent this. We have more than 30% of our kids in the state of West Virginia being raised by somebody other than their mom and dad. I can barely swallow thinking about that. So I think whenever we're looking at this issue, there's things that we can do, and I'm not a DHS guy or a child services. That's not my area of expertise, but I know how addiction impacts that. And I think that I want to go far, far upstream and prevent this from being needed in the first place by getting the mom and dad the resources they need to be able to raise their children. And here's one last thing on this issue, is I have people get this, well, we can kill our way out of this, right? If we just let enough of, quote, these people die, eventually they'll get out of the gene pool. I mean, that's the thought, and I've heard it numerous times. And there's one huge fly in that ointment. And the fly in that ointment is that slot machine I talked about, right? Genetics, trauma, and opportunity. That trauma is loss of Dad Andre. So we let Andre die. He's expendable. So let's let him die. Andre's got 2 kids. One of the ACEs, adverse childhood experiences. One of those is loss of a parent. So let's lock them up. Because we're creating the next generation. And we got to stop doing that. So this is of paramount importance. Anything we can do to aid that family early on. We were talking before we came in here with Representative Toledo, and it's so right what we're talking about. People don't care about this. Right? Don't care. Until it's in your living room. Right? Then you care. My lobbying style, I've got a unique lobbying style. I'm not a lobbyist. I've had success because of politicians and congressmen and senators. I help their kid. Because they knew somebody to call. And my question to them always the same. What if you didn't know me? What if you were out there and you had to look it up in a phone book, or in my phone book anymore, sorry. Look it up on your phone. Who do you call? And so I think we have to make this really easy as far as treatment of mom and dad to prevent these types of things from happening. Of course, there's other services around that we can do to support, but I want to go as far upstream as possible. And that far upstream is from the point that mom brings the child home from the hospital.
I think going upstream is so important as a person, in recovery. The more that I do this work, the more that I, get involved and try to advocate for those who are struggling. I think so much about my children who, range from 13 down to my youngest is 4 months today. And I just think it's so critical. What we do now for those kids can make such a difference. I know, the friends that I've had, the friends that we've all, had and lost, anything that we can do to prevent that is key. And I think, my hope, again, in the absence of having Rear Admiral Jones today, is that everybody educates themselves on the work that is happening. There's so much happening around prevention, that I wish we had more time to talk about. But one final question, we asked this to Regina and Jim already. Before, I'll start with either one, whoever wants to jump in. But for you two, what words of advice would you have for a new member of Congress in this new session?
I'll just go back to what I said earlier. I think do the due diligence. Educate. Prevention works. Treatment works. Recovery works. But we got to think outside the box. My philosophy is we have to do business like the drug dealers do business. We need 24/7 operations. We need more intervention in our community. Dare didn't work for me. I watched Dare growing up. I was a participant there, and it didn't do nothing for me. The thing that stood out the most for me in the 80s was this is your brain being fried, a fried egg. I know y'all millennials don't know about that. But we need to really look at how do we be more creative. And we need to look at not only being creative, but we need more young people that want to aspire to work in this field. This is not a moral issue. People are struggling and suffering just like people struggle and suffer with diabetes or any other type of chronic illness. So we have to educate our community. Thank you.
Addiction's treatable, treatment works, and people recover. That's it. It's true. When I got hired in West Virginia, they gave me an office, a nice office, glass, like you see outside on Capitol Street, Charleston, West Virginia. I gave it to my deputy, and I took a cubicle because I don't plan on spending any time in that office. Get out and look and see what's going on in your community. The opposite of addiction is not recovery. It's community and relationship. And when we start to do that, we'll really start cooking with gas. We really will. Guys, it's really hard to do this from an office. Go out and meet these folks because we have this concept of what these people are like. And I don't find that to be true. And I want to tell you this because this just happened. I'm going to cry. I'm sorry. I moved my phone when Jim needed that cord and hit it. And there's a message on there from my wife. She goes, "Hey, I want to say I'm proud of you." How about that? Right? We're proud of you. But that's what we're talking about. And you know, when I look back at the years I lost with my kids, and the years where I wasn't a good husband, and I know you know what I'm talking about.
Oh, yeah.
Right? I mean, to have that, and to know that I have that because I was given an opportunity and stepped into a system of care that allowed me to do that. I love Tennessee. I know I work in West Virginia. I'm in Tennessee. And Alex Haley was in Tennessee. And Alex Haley talked about a turtle on a fence post. And if you get that vision in your mind right now, all right, there's one thing everybody in this room knows for sure. Think about a turtle on a fence post. It didn't get there by itself. When you see somebody like me or Harry or Andre, we didn't get here by ourselves. We stepped into a system of care that put us here today. And what I'd advocate for is the creation of a system of care that no matter where you touch it, you get the help that's right for you, that helps you build what we get to do. And I think that's possible.
As we open it up for questions, I just want to quickly again thank everyone on the panel. I want to thank the Addiction Treatment and Recovery Caucus, GHAI, the O'Neill Institute. I'm not a I could go on and on, but really everybody in this room for showing up, as well as all the members who came. But really for me as a person in recovery, as a person who's honored to just sit in the presence of all of you, I'm grateful for everybody coming. I think the storytelling is key, the data is key, but we have to show up and we have to talk about it. So thank you all for coming out, and I hope to see you soon.